We continue with our discussion around the issue of illegal and unsafe abortions. For this, we're joined via Zoom by Thembi Zulu. She's the Manager for Sexual Reproductive Health at the National Health Department. Thembi, good afternoon. Thank you for joining us on the SABC.
Good afternoon, and thank you for having me.
So, Thembi, we understand that this is an annual campaign for the department. Why did you pick abortions as a subject matter in particular?
In actual fact, is a campaign for sexual and reproductive health, and abortion is part of sexual and reproductive health. And we single out a bit abortion because we realize that people they are taking advantage of women who seek for termination of pregnancy or abortion. So they advertise putting illegal advert, and we realize that if there's illegal adverts that are pasted all over in towns, so women, they tend to not understand whether those illegal adverts are from the Department of Health. That is why we stood up and saying that we need to educate our community. We need to educate South Africa to say those illegal adverts that are pasted in municipality poll, that are pasted on the walls, so they are not from us. That's not how as we clinicians, we advertise ourselves. So we just emphasize to our community that they must not use those services. Those people are criminal. Actual fact, they are doing our against because there was a reason why we as a country introduce the termination of pregnancy, because we didn't want women to go for illegal abortion in the country.
Thembi, what challenges do you find to be prominent amongst young girls in campaigns of this sort? What are the equity issues that also rise in access to abortion care in South Africa?
What we normally do as we conduct this campaign, because we don't want the hearsays, we engage young people, and then we want to hear from them. Why is the challenge for them not to go to our public facilities? Because we provide family planning or contraceptive services, providing different method of contraceptives, and as well as the very same abortion. Or because in South Africa we don't even call abortion, we call it a choice on termination of pregnancy, because there is a law that is actually guiding the implementation of a termination of pregnancy. So what they normally say, young people, they're always in a fast move. They don't want to wait longer. If maybe like they go to the facility, they see that maybe there's kind of a queue, and then they go back. And because these people, they advertise themselves, and then they say they are free same time, and because they cannot differentiate whether that advert are coming from us, they end up going there because they realize that those people are faster than us.
Thank you for that context. We're looking at the unique situation in South Africa, given our history. Perhaps also as we look at the future generation and assessing teenage pregnancy, which has been a concern in South Africa, especially amongst girls who are at school. They're at school-going age. How do we ensure that while there are campaigns of this sort, that they are followed by decisive action? How does family planning advice also come into abortion care?
We believe, first of all, in continuous information sharing, and we believe in communication, so that people, they must understand the method or different method that is available in the public facilities. And as well, also, we conduct training to the implementers so that as they come to our facility and they receive a good reception, because that's what we want, so that they are encouraged to come to our facilities.
All right, so as we look at The barriers to abortion, even though it is legally permitted, what would you say exist in both rural and non-rural areas? What more can be done to access and to improve access, rather?
What can be done to improve access? The continuous value clarification workshop, because we cannot run away to the fact that some people, they believe that if a person go for termination of pregnancy, that person is not a Christian, and then they believe that a person is killing an innocent baby. But then we as the department, we continuously engage the community as well, so that they must understand the act, so that also they must understand that a woman has a right to exercise, has a right to exercise her own choice. It's within her choice whether to continue with the pregnancy or not, without being judged by anybody. And also we encourage the woman to say, and it's her decision to decide whether to continue with the pregnancy or not, irrespective that maybe that woman has a family. But however, the communication between the family, or even if it's a young person, and then also we encourage as the department that before we can actually provide the service, and then we encourage that she can talk to the family, but then that doesn't mean that if maybe the family doesn't approve, the service is gonna be denied. It's just that normally we talk and saying that she can have a support system. But basically, a person who's important is a person who's pregnant.
All right, Thembi, Zulu, it seems like there is an integrated, holistic approach we're looking at too, perhaps also, looking at the strides that have been taken and some of the barriers to entry for that access to abortion. But we thank you for your time and your work. Thembi Zulu is a manager for sexual reproductive health at the National Health Department.